executive order eliminating the idea of gender identity.
Now live in a state with a ban on their health.
A lot of people who've been granted asylum.
In my 30 years of being in NCLR, this is the worst situation I've ever seen. The law has now become just vicious towards our community.
LGBTQ asylum seeker.
This administration bombards us with attacks, and very often these attacks are illegal and unconstitutional. This is an attempt to overwhelm us. Exhaustion is a very big part of this strategy.
We are not babes in the woods here. We are using every bit of NCLR's collective knowledge, skill, expertise. We've been here before. We are only wiser, we're more seasoned, we're more ready this time around.
We don't cede any ground, and if someone is going to try to hurt our community, they're going to have to fight us for everything.
Our strategy is to stop harmful policies where we can, delay them where we can, to reduce harm where we can, and to build a foundation for the future.
In fact, NCLR, along with our partners at Gala, challenged the first 4 anti-LGBTQ executive orders before any other group challenged one.
Prisons to move trans women out of women's prison. It also ends gender-affirming care.
We knew, as everyone did, that if these women were moved to men's prisons, they would be immediately targeted for violence and assault. And on that same day, we obtained our first emergency federal court order stopping the federal prison system from transferring those women and ordering the prisons to continue their medical care. These cases are in line with NCLR's strategy of protecting the most marginalized people in our community. Each time this administration tries to normalize this kind of extreme violence and harm, we must respond.
The issues that we're looking at, they're not just LGBTQ issues. When essential healthcare and healthcare research is gutted, that's something that affects all of us.
The Justice Department's hunting for private patient data from doctors and hospitals that treat transgender young people. And how unprecedented do you think this move is?
Completely unprecedented and shocking. This has absolutely no legal basis whatsoever. It's clearly designed to try to intimidate and harass these doctors from providing care to these families who really need support.
We helped organize a legal response to the subpoenas so that families can fight the disclosure of their private health information.
16-year-old A.B. Hernandez has become the target of a right-wing campaign to ban trans athletes from California youth sports. Over 30 adults gathered to heckle her at a recent track meet.
I'm still a child, you're an adult, and for you to act like a child shows how you are as a person.
Because there are so few transgender athletes, again, their strategy is to attack a very vulnerable group of mostly children. We have a case in Utah, we have another case in Arizona. In both of those cases, we stopped the bans from going into effect.
An LGBTQ asylum seeker who is flown to El Salvador, even though...
So asylum, which is near and dear to our hearts at NCLR, had such extraordinary success over the years in obtaining protection for LGBTQ people. It is on life support right now.
The administration essentially is sending people into hiding.
We'll see gay and transgender people who have valid asylum claims are being sent to countries where they face imprisonment, torture, death. This is the worst, the most serious situation I've ever seen facing our community.
I would say the largest part of our practice right now is filing habeas petitions in federal court. I am glad to say that habeas petitions are working. The judges now are ordering immediate release for those individuals, but the difficulty is just the numbers of people who are locked up needing help.
Siding with a Christian counselor in Colorado, the U.S. Supreme Court today tossed out the state's law banning conversion therapy that tries to change a teenager's sexual orientation or their gender identity.
We have come up with an entirely new legislative approach. We've been working with state groups and legislators across the country. We are working in this very interesting new way to support conservative parents who have put their children into conversion therapy.
This is not a blue or red issue. This is not a left or right issue. This is an issue of parents loving their kids and wanting to keep them safe.
We're working to meet parents where they are and to help connect them to information, resources, and support. So this campaign that we've been working on for only a few months has already reached more than 1.7 million people.
NCLR is not doing this work alone. National, state orgs, grassroots organizations across the country. NCLR plays a pivotal role in pulling these groups together.
We developed a curriculum for legal aid providers and trained thousands of legal aid staff and pro bono attorneys over the past 15 years.
There is always a counter move. There's always something we can do. That is our mindset.
Executive order banning transgender Americans from serving in the military.
We filed an immediate challenge to President Trump's transgender military ban days after he announced it. And we got right out of the box one of the most powerful decisions I've ever seen in my entire career, finding that that ban was, quote, dripping with pretext and soaked in animus. Despite how dark the current moment is, I am actually very optimistic that we are building a foundation for even more protections and a more supportive world for all of us.
NCLR proves over and over again that it's not the size of your organization, but the heart of your organization that matters. And if that is the measurement, there's not a bigger one than NCLR.